University of Vermont's Medical Center postpones the construction of their new surgical center after making what regulators say is, quote, too much money. And now UVMMC procedure prices are going down. Tonight, our Laura Ullman investigates why.
Quality health care, affordable health care, and accessible health care. Many of those in the industry say you can't have all three.
Right now, all the focus in Vermont is on only affordability. And I don't think that's going to get us where we're trying to get to.
Affordability is also access. When people can't afford healthcare, they don't access healthcare.
On Friday, the University of Vermont Medical Center announced they're suspending building a new surgical center due to what they describe as the regulatory Green Mountain Care Board's imposed budget constraints. The Green Mountain Care Board says they're trying to achieve patient affordability through regulation. UVMMC says the board's efforts impede access and increase wait times. In a press release, they say the Green Mountain Care Board penalized UVMMC for meeting increased demand and providing more care to patients.
The medical center to stay within our budget. $100 million of expenses. There's no possible way to reduce that without providing less care.
We disagree with that. When UVM has said they're going to have to cut services because of the board decisions, access actually went up.
UVMMC tells WCAX they made $80 million in revenue in 2023. A hospital's revenue is based on how much they're charging their patients. It's different than their $60 million profit margin.
We're seeing more Vermonters who need us and sicker Vermonters.
The Green Mountain Care Board reviewed UVMMC's final margins, finding that the hospital had under-budgeted government payer revenue and over-budgeted expenses, which made commercial insurance rates higher in 2023.
They requested a rate higher from Vermonters than was necessary.
The Green Mountain Care Board says UVMMC received additional funds from its graduate medical education program, changes in their federal designation, and their New York network hospitals that they did not disclose in their budget or during the fiscal year.
In other years, they've allowed our revenue target to exceed what we expected because they understood it was for more patients. This year, they're handling it a little differently.
So the Green Mountain Care Board is now requiring the hospital to lower their procedure prices for patients. That will in turn decrease the hospital's revenue, kicking the outpatient surgery center project down the road. In the studio, Laura Ullman, Channel 3 News.